Foundation of hands-on treatment. Alright, let's talk about manual therapy. What is it really? Simply put, manual therapy is a specialized form of physical therapy. It involves using your hands to treat musculoskeletal pain and disability. We use our hands to diagnose and treat problems in soft tissues. We use our hands to diagnose and treat problems in joints. This is a core skill for any physical therapist. It's what separates us from just being exercise coaches. We are using skilled, hands-on techniques to create a change in the body. This change allows our patients to move better and feel better. It's about getting in there and directly influencing the tissues. The importance of manual therapy and rehabilitation can't be overstated. Let's break down the main types of manual therapy. We're going to focus on the big three. Joint mobilizations. Traction. Therapeutic massage. Each one has a specific purpose and application. Understanding the differences is key to becoming a great clinician. You need to know which tool to use for which job. It's not a one-size-fits-all approach. Knowing when and why to use each technique is what separates the experts from the novices. It's about clinical reasoning and skilled application. Let's dive deeper into joint mobilizations. What are they exactly? Mobilizations are skilled, passive movements applied to a joint. We, as therapists, perform these movements on the patient. The patient remains relaxed. We use our hands to apply a specific force, a specific direction, and a specific speed. This is all based on our knowledge of arthrokinematics, how joint surfaces move on each other. We might be performing a glide, a roll, or a spin. The purpose is to restore pain-free joint play necessary for full range of motion. First, properly position your patient. They should be comfortable and relaxed. Place the joint in a loose-packed position where the capsule is most lax. Stabilize one side of the joint. Your stabilizing hand prevents unwanted movement. Apply force with your mobilizing hand as close to the joint line as possible to move the joint, not the whole limb. We typically use a 1 to 5 grading scale. Grades 1 and 2 are small amplitude movements, primarily for pain relief. They stimulate mechanoreceptors and gate pain signals. Grades 3 and 4 are larger amplitude movements to tissue resistance, stretching the capsule to increase mobility. Grade 5 is a high-velocity, low-amplitude thrust requiring advanced training. Now let's shift our focus to traction. Traction involves a pulling force. We are distracting, separating two joint surfaces to decompress a joint. This reduces pressure on articular surfaces and can open the intervertebral foramina. By creating more space, we alleviate pressure on a compressed nerve. It's powerful for radicular symptoms, pain that travels down an arm or leg. For cervical traction, the patient lies supine. You position at the head, cradle the neck, often cupping the occiput, forearms, resting for stability. Apply a slow, gentle, longitudinal pull in line with the cervical spine. Tune into the patient's response, enough to relieve, never to provoke pain. Traction can be manual or mechanical. The key is the right force and direction. Common indications: spinal stenosis, disc herniations with nerve root impingement, and general joint hypomobility or stiffness. For sciatica with an L4-L5 herniation, lumbar traction, sustained or intermittent, can distract vertebrae, centralize the disc, decompress the nerve, and rapidly centralize symptoms. Leg pain decreases and moves toward the back, an encouraging sign. Let's get into therapeutic massage. Everyone thinks they know it, but in PT it's a precise clinical tool. We use massage to manipulate soft tissues, muscles, tendons, ligaments, fascia. The goal isn't just relaxation, though that's a nice side effect. We aim to reduce muscle spasm, break down adhesions, improve blood flow, and decrease pain. It prepares tissues for stretching and exercise and calms the nervous system. Effleurage, light stroking, great to begin and end, warming tissues and calming the patient. Petrissage, kneading, squeezing, rolling, boosts circulation and clears metabolites. Friction, deep, circular or transverse movements to remodel scar tissue, e.g., chronic tendinopathy. For upper trapezius tightness with trigger points, start with effleurage, progress to petrissage, then apply ischemic compression or focused friction to the knot. Massage benefits overuse injuries like tendinitis and strains, helps postural pain, reduces swelling with lymphatic techniques, and offers psychological relief. Hands-on care reduces anxiety and stress, often major components of pain. Now let's put it all together. Imagine a 45-year-old tennis player with right-sided neck pain, tingling down the arm into the thumb and index finger, worse after tennis and computer work. Your evaluation shows limited right rotation, pain with extension and right side bending. Palpation reveals guarding and trigger points in the right upper trapezius and levator scapulae. Spurlings reproduces her arm symptoms, suggesting nerve root irritation at C5-C6. Joint playtesting shows hypomobility at the right C5-C6 facet. Clinical picture: cervical radiculopathy from facet dysfunction and muscle guarding. Plan: integrate 3 manual therapy techniques. Start with therapeutic massage, effleurage and petrissage to decrease spasm and calm the system. Then apply gentle, sustained cervical traction to decompress C5-C6 and open the foramen. Follow with a grade 3 or 4 upglide at right C5-C6 to improve right rotation. By combining massage, traction, and mobilization, you address muscle, nerve, and joint components. One cohesive session. We've covered a lot. We've defined manual therapy, mobilizations, traction, and massage, how to perform them and when to use them. Manual therapy is a skill. It requires practice, refinement, and continuous learning. Reading is one thing, feeling tissue response is another. The art and science together. Safety first. Evaluate thoroughly. Screen for red flags and contraindications. Never mobilize a fracture, tumor, or cord compression. Start gently. It's better to undertreat initially. Monitor and adjust. Manual therapy isn't standalone. It creates a window. Reduce pain, improve mobility, then load with exercise for long-term change. Be deliberate, be specific. Always have a clear reason for every technique. Pursue continuing education and mentorship. Practice often. You'll become more confident and effective. Mastering manual therapy elevates your practice and results.